Here we are in your second trimester and things are getting serious. Now, those first few months are really about survival, and today we are starting to look towards the future. So what do we need to do in preparation for this baby? And if you're looking for more information about where you are in your pregnancy, this comes from a full post on my website. I'm going to put the link down below. Remember, in the medical community, we prefer to use weeks of pregnancy. So month 4 is weeks about 13 to 18, and it's a really exciting time during your pregnancy. Okay, what should you be doing? You're gonna make sure that you're still attending those prenatal appointments. Now, they do seem sort of far apart early on in pregnancy. And remember, those appointments are just for routine care. If you find something outside of the routine, it's important that you call in, and you might even need to be seen between appointments. I think now is a great time to start thinking about what type of birth class you're interested in. There's one that I recommend. I'm going to put the link down below. I also don't think it's too early to start thinking about what you would like at your birth, and I have a whole birth plan freebie series that you can also get down below. Remember, a birth plan is what you would like in a perfect world versus what will actually happen, because you are turning into a parent now and nothing seems to go to plan. If you are on social media, now is the time to be very mindful about who you are following and watching for your pregnancy content. There's lots of great pregnancy educators out there, including me, and I will put my social media down below, but make sure that you're following someone that you can trust. It can be difficult to follow someone who doesn't have credentials behind their name and lots of experience, so make sure that you're looking for good people to follow. And thank you for joining me here on YouTube. If you like this series, please hit the like button and subscribe so we can hang out for the rest of your pregnancy. Now, in the last video, we talked quite a lot about aspirin. However, they actually say that aspirin needs to be started by 20 weeks of pregnancy to start at between 13 to 20 weeks of pregnancy. So if you have not had that conversation with your provider, now is still a great time to be doing it. Remember, you're taking aspirin to help your placenta grow in a good way. That's why we recommend starting it early on in pregnancy. It's super important, and the guidelines behind it are changing a lot, so make sure that you talk with your provider about what's right for you. Remember, aspirin is not right for everyone. You need to be talking with your provider. And as a reminder, even if you are young and healthy, your provider should still be having this conversation with you, because some of the things are based off of what happened with your family members. Did your sister or your mom have preeclampsia? And that's not something that they would know based just looking at you. I do not think that it is too early to start finding out about maternity benefits at work. And along with that, during this time frame is when most people start to announce their pregnancy. I have a whole post on the best time frame to announce your pregnancy. I'll put the link for that down below. Tell us in the comments, when did you start to tell family and friends and work that you were pregnant? I will say, as a nurse, most of the people at my work knew that I was pregnant early on, because it's important that we avoid specific things during pregnancy as a healthcare worker, including like x-rays, sometimes different types of drugs and things like that. Ultimately, as we get into this second trimester, you are really starting to think towards the future. Think about what's going to change, what's going to be different as you have this baby. Now, one of the things that a lot of people end up facing is preeclampsia. I think it's super important that you understand it, even though you're early on. I'm going to put a video about preeclampsia up here. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.